Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about IBS and stress. So what is IBS? IBS stands for Irritable Bowel Syndrome. IBS is a functional GI condition without a known cause that can contribute to symptoms such as bloating and gas, abdominal pain, constipation, and/or diarrhea. On a side note, there is no specific test to diagnose IBS. A question I get asked often is, can stress impact my gut? Can stress cause IBS-like symptoms? The short answer is yes, IBS can be caused and triggered by stress and anxiety. Stress and anxiety increase the sympathetic or fight or flight response, which negatively impacts the gut, resulting in symptoms. This effect happens via the brain-gut axis. A chronic stress response can result in slow motility and constipation by decreasing the migrating motor complex activity, but others may experience diarrhea. High amounts of stress or an acute stress response more often result in diarrhea. The classic example is someone ends up being so nervous or anxious that they end up getting diarrhea. So what are some of the common stressors that can drive this response? Here's a list of some common stress triggers. Work stress, financial stress, relationships, major life changes or events, low blood sugar, inflammation, pain, illness, infection, anxiety, depression, and more. Any of these triggers can lead to IBS flares or increase in symptoms. A lot of people with IBS can relate to anxiety. Some may just have a baseline level of anxiety, but a lot of other people have more anxiety because of their gut symptoms. Here's a common scenario that we see in our patients. Patient comes in with IBS-like symptoms, they do all this traditional medical testing, all the results come back negative, and then they're told that anxiety is the cause of their gut symptoms. A question I commonly ask these patients is, if your gut health was perfect and you didn't have any digestive symptoms, how much anxiety would you still have? The digestive symptoms that come along with IBS make someone not want to go out to eat with their friends or go over to their relative's house for dinner because they know how they're going to feel after they eat. This then creates more anxiety, which can then increase their IBS symptoms, whether that's gas and bloating, abdominal pain, constipation, or diarrhea. It's a vicious cycle that impacts the brain-gut axis and then the gut-brain axis. The root cause in a case where the gut seems to be the primary culprit is to get to the root cause of the gut issues to potentially help with the anxiety. Whether the gut is the primary culprit or isn't the primary culprit, is there anything else we can do to help with the anxiety? There are many different techniques and strategies that we can use to help manage the stress and address the anxiety, such as mindfulness and relaxation techniques like meditation and deep breathing, cognitive behavioral therapy, or CBT, various forms of exercise and physical activity, and there are also various at-home apps and online programs that can be helpful as well, such as the Calm app, HeartMath, Dynamic Neural Retraining System, or DNRS, and more. Now that we've talked about some of the common stressors with IBS, the next thing we need to talk about are dietary triggers. Here are some of the common food triggers in IBS: grains, dairy, sugar, caffeine, spicy foods, high FODMAP foods, and more. At Restorative Health Solutions, we do very thorough food testing and microbiome testing to individualize the diet for each patient with IBS. Here are some of the tests that we run at Restorative Health Solutions to help personalize the plan. Genetic testing for gluten sensitivity predisposition, food allergy panels, food sensitivity panels, stool testing, organic acid testing, nutritional deficiency testing, adrenal and cortisol testing to understand how much cortisol or stress hormone your body is producing, hormone panels, and more. And lastly, I want you to know that there is hope if you have IBS. We see IBS get better very often with this comprehensive approach and test don't guess strategy. Well, I hope you learned a little bit today about the IBS and stress connection. And until next time, I'm Dr. Paul.